Hi everyone, here is the video regarding the topic hypersensitivity. So there are basically four types of hypersensitivity: type 1, type 2, type 3 and the type 4. Hypersensitivity is an immune response mobilizes the battery of effector molecules that acts to remove antigen by various mechanisms, and these effector molecules induce a localized inflammatory response that eliminate antigen without extensively damaging the host tissues. So hypersensitivity has two components: primary dose, that is first dose, and the shocking dose, that is second dose. It is classified into immediate type or the delayed, and the second one is the delayed type. Gel and comb classify hypersensitivity in reaction into four types, and it can be classified into immediate type and the delayed type, whereas the type 1, type 2, type 3 is included in immediate type and delayed type is of type 4. Type 1 hypersensitivity includes the anaphylaxis, and the second one is the atopy. It is an antigen reacting antibody. So in this, IgE is regulated called allergic hypersensitivity, and IgE is responsible for sanitizing mast cells and providing recognition of antigen for immediate reaction. So type 1 hypersensitivity, the figure is here, in which the B cell has two types of cell, that is memory cell and the plasma cell. And then plasma cell has when the allergens or specific antibody react with the plasma cell, it gets sensitized. The sensitization is called as mast cell or the basophil cells, and the Fc receptor for IgE binds to this sensitized mast cell, and binding of allergens to the IgE causes degranulation of the mast cell. So in this way it reacts. So first part of the anaphylaxis of the type 1 hypersensitivity, the flowchart is here. The mast cell, which is also called as the prime mediators of the anaphylaxis, the basophils and the eosinophils are the effector cells in the anaphylaxis, and the three cells type contain cytoplasmic granules, act as a mesomediator, mediator, produce lipid mediators and cytokines that induce inflammation. So histamine is most important mediator of the anaphylaxis, found in the granules of the mast cells or the basophil cells. Slow reacting substances of the anaphylaxis is leukotrienes, principal mediator of the bronchoconstriction of the asthma. They cause increased vascular permeability and smooth muscle contraction. Next one is the serotonin, found in the preformed state in the mast cells and platelets. Prostaglandins and the thromboxane also is included in the anaphylaxis. Anaphylaxis is an acute, life-threatening reaction usually affecting multiple organs like skin, respiratory tracts, and cardiovascular system. The next part of the type 1 hypersensitivity is the atopy, term coined by the Koka, and it is localized to specific tissues, often involving epithelial surface at the site of the antigen entry. Common manifestations are the asthma, rhinitis, urticaria, atopic dermatitis. Method of allergy testing by skin test is here. The next is a type 2 hypersensitivity. It is mediated by the antibody directed against antigen on the cell membrane. Antigen-antibody reaction leads to the complement activation, resulting in the formation of the membrane attack complex, that is MAC, which is very important. This complex then acts on the cells, causing damage of the cells as seen in the complement-mediated lysis in RB hemolytic disease, transfusion reaction, or the hemolytic anemia. The antibody coating the target cells can also cause its destruction by the acting as an opsonine, and this mechanism is important in immunity against large cell pathogens such as the helminths. This figure describes the type 2, that is cytotoxic hypersensitivity, in which the target cells and the binding of the antigen on the surface of the target cell, and the reaction proceeds, and it's formed the membrane attack complex. Here is example of the blood group type, that is group A, group B, blood group AB, and the blood group O. So antibody in plasma, antigen in the RBC. The transfusion reaction, a large number of proteins and the glycoproteins are present on the surface of the RBC, and the antibody to these antigens are called the isohemagglutinin. The erythroblastis fetalis is when a pre-sensitized Rh-negative mother mounts an immune response against Rh-positive. The RBC of the fetus result in the severe hemolysis, leading to anemia and the hyperbilirubinemia, which can be fatal. So drug-induced hemolysis and the rheumatic fever is an example of type 2 hypersensitivity. The third one is the type 3 hypersensitivity, can be categorized into the Arthus reaction and the serum sickness. It is mediated by the antigen antibody immune complex, which induce our inflammatory reaction in tissues. So figure here of type 3 hypersensitivity, in which the B cells and the antigen produces when B cell produces the plasma cells and the memory cells, and then plasma cells binds with the antibody and antigen and forms the immune complex formation, and then the complement system is activated and the tissues damage and the neutrophil activation. So Arthus reaction is an inflammatory reaction caused by deposition of an immune complexes at a localized site. This reaction is endometrous in the early stages, but later can become hemorrhagic and eventually necrotic. Next one is the serum sickness, which is a systematic inflammatory reaction caused by deposition of immune complexes in many sites of the body. So manifestation may be the fever, lymphadenopathy, rashes, arthritis, splenomegaly, and the eosinophilia. Some other diseases like the autoimmune disease, drugs, reaction, infectious disease. Type 4 hypersensitivity can be the contact hypersensitivity given by the Robert Koch, tuberculin type hormone hypersensitivity. It is a type of delayed hypersensitivity which starts hours or days and lasts for days. It is characterized by the large influxes of the non-specific inflammatory cells, macrophages, and being mediated through the cell-mediated immunity. A variety of the antigen-presenting cells, including the Langerhans cells and the macrophages, have been shown to be involved in the activation of the DTH response. So figure describes the type 4 hypersensitivity in which the APC, that is antigen presenting cells, binds with the T lymphocyte with the help of the meso-histocompatibility, and then the formation of sensitized T lymphocytes and the macrophages is activated, and the activated macrophage form the granulosa formation. Contact hypersensitivity includes drugs like the sulfamides, neomycin, plant products, poison ivy, IVY, formaldehyde, nickel, cosmetic soaps, etc. Tuberculin type hypersensitivity reaction skin, it is in this the skin test is carried out to determine the disease of the tuberculosis. In this, small amount of the tuberculin is injected intradermally, development of a red slightly swollen form lesion at the site of the injection after 48 to 72 hours indicates the positive test. Here is a sum of the type 1, type 2, type 3, type 4 hypersensitivity, in which the antigen AB is the antibody reaction time, transfer, and the condition. So this is all about the hypersensitivity and their types and their details. Thank you and keep watching.